Brain tumor is a conglomeration of cells of abnormal growth within the skull or even within the brain. A craniotomy is an approach for us to access a brain tumor through the skull. My name is Dr. Florian Rosa. I'm neurosurgeon at the Department of Neurosurgery of the Cleveland Clinic, Abu Dhabi. And I'm part of a team of neurosurgeons who take care of patients harboring a brain tumor. For me, it is very important to build up a very good relationship with the patient because every craniotomy might have a major impact in the life of the patient, so we really have to trust each other. The brain is a very complex organ. The positioning is everything. So how do we access this tumor without injuring the adjacent healthy brain? We will do a skin incision and flap the skull over and clip it accordingly. We're going to do one burr hole and cut the bone flap open, which will be replaced later on. We have to cut the dura open to see the underlying brain tissue. Once we identify the tumor, we get into the microscope, and with microsurgical instruments, we first remove the inner part of the tumor until we go to the edges, making sure that the healthy brain is being preserved while resecting the tumor completely. We will close the dura in a watertight fashion. The bone flap will be replaced and fixed with very tiny mini plates, and the skin will be closed. The patients have to know that these surgeries in the brain are risky and difficult procedure. In the brain, the rehabilitation process is different. Even if we had a very successful surgery and we were able to remove the tumor completely, there might be temporary side effects with the patient showing some neurological deficits over time. So we have to make sure that the patient continuously training the function and sometimes even relearn these things which might have been lost during surgery. It is very rewarding if you go back to the patient and you see that everything which has been discussed has been achieved and the patient regains hope for his future life, and we were able to deliver all the excellent care we were talking about.